Good evening, everyone. I am Dr. Sanjana Chavan from the Indian Dental Association, and I am delighted to welcome you to our student education program. Today's webinar is focused on Introduction to Orofacial Myofunctional Therapy. Our speaker today is Dr. Tanzim Ahmed, pediatric and preventive dentist and diplomate of the Orthodontic World Institute, Spain. She is the Chief Pediatric Dental Surgeon at the Tooth Buddy Children's Dental Care, Guwahati, the first exclusive pediatric dental clinic in the Northeast India. An award-winning clinician, including the FAMDent 5 Under 5 Dentist of the Year 2025, she has extensive training in myofunctional orthodontics and has been an invited speaker at several national conferences. We are privileged to have her share insights on the today's topic of orofacial myofunctional therapy today. Okay, over to you, Dr. Tanzim.
Thank you so much. Am I audible?
Yes, ma'am.
Okay. So good evening, everyone. First of all, I'd like to thank the IDA Education Academy for inviting me here and making me a part of the Student Education Program webinar series. And today, before I begin with my topic of presentation, I would just like to tell a few things about myself for those of you who do not know me. Yes. So on the screen, you can see that's a brief summary of my academic as well as clinical journey up till now. I am Dr. Tanzim Ahmed, pediatric dentist, running an exclusive pediatric dental care center in Guwahati, Assam, called the Tooth Buddy Children's Dental Care. And there are a few things that I would like to highlight here is on this year itself, on the International Women's Day, I was awarded as the Distinguished Woman of the Society by the Indian Society of Pediatric and Preventive Dentistry. I have been a recipient of the FAMDent Excellence in Dentistry Awards 3 times in a row in 3 consecutive years under various award categories. I have also been the recipient of the Dr. S.N. Pandey Award by the South Asian Association of Pediatric Dentistry in the year 2024. I have been invited as a guest speaker across various platforms in the country, and currently I'm working actively in the spread of the awareness of children's oral health in the northeastern region of the country. So that's a little bit about me. Now, coming to my today's topic of presentation, Introduction to Orofacial Myofunctional Therapy. Since this is a huge topic of discussion, what I am going to do today is cover some basic fundamentals behind myotherapy and why it is important for us as pediatric dentists or even as general practitioners to know and learn about this subject. So before we delve deeper into the topic, let us learn a few terminologies. The first one is orofacial myofunctional disorder. Now, as the name itself suggests, orofacial is something that is related to the face and the mouth. Myofunctional is the functions of the muscles. And disorder is any abnormality. So orofacial myofunctional disorder is any abnormality in the functioning of the muscles in the orofacial region. So that's OMD or orofacial myofunctional disorder. The second terminology that we all need to know is orofacial myofunctional therapy. So any treatment that we do to correct or rectify the functions of the muscles of the orofacial region It is called as orofacial myofunctional therapy, OMT, or just myotherapy in short. So from here, it is very clear that the disease that we are trying to treat is orofacial myofunctional disorder, and the treatment that we do in order to rectify this disease, it is called as orofacial myofunctional therapy. The moment we learn these two terminologies, the next question that pops into our minds is that, is it a new concept? Is orofacial myofunctional disorder some kind of a new disease that has come up in the 21st century? Or is orofacial myofunctional therapy some kind of a new treatment modality that we have developed over the years, in the recent years? So the answer to these questions is no. Neither orofacial myofunctional disorder is some kind of a new disease, nor orofacial myofunctional therapy any new form of treatment. OMD, orofacial myofunctional disorder, has been into existence since time immemorial. And myotherapy, the treatment protocols that we follow today, have also been in use since many, many years. If you ask me, I can actually go back in history and note those historical landmarks where different people from different walks of life have mentioned regarding the existence of orofacial myofunctional disorder in the human race since a very long time. And there have been so many dentists at different time periods when they have highlighted about the importance of the use of myotherapy in the field of dentistry in some form or the other. Maybe at that point of time, they were not using these two particular terminologies, but if we study the scientific literature that is present with us today, we understand that these concepts have been around since a very long time. So today, I will not go into the details of the history of functional dentistry because it is beyond the scope of today's presentation. However, what I want all of you to do is go back slightly in time and maybe try to remember and recollect whatever we already know regarding functional dentistry. So let us go back to our college days when we were undergraduate students, final year classes in the subject of orthodontics. There was one lecture you will remember, of course, if you had attended those classes. There was one lecture on the topic of theories of growth. In that lecture, we were taught about different theories of growth put forward by different authors at different time periods. One of the most popular theories amongst those theories of growth was the functional matrix theory of growth, given by Melvin Moss. Remember, what did that theory say? It said that the growth of the hard tissues in the human body is determined by the soft tissues which are surrounding it. For example, let us understand this with the example of this forearm. So according to that theory, the growth of the bone of this forearm will be determined by the functionality of the muscles or the soft tissues that are attached to it. So to put it very simply, what he said was function determines form. The function of the soft tissues will determine the form of the hard tissues. Now, when we apply this concept of function determines form to our field of dentistry, we as dentists, what is the area of the body that we are dealing with? We are mostly dealing with the orofacial region of the body. So what are the hard tissues we are commonly dealing with? It is the maxilla, the mandible, and the teeth. These are the hard tissues that we deal with in our day-to-day clinical practice. And now, what are the soft tissues which are surrounding these hard tissues? They are the tongue, the lips, and the cheeks. Or in other words, if we talk in terms of muscles, then there is the musculatures of the tongue, the perioral musculature, the buccinators, and the muscles of mastication. So all of these muscles in the orofacial region, they have a dynamic relationship with each other. Why I call it as a dynamic relationship is because at every point of time, there is some muscle or the other that is always in function. So they are all in a dynamic relationship with each other, and all of these muscles, they function harmoniously to create a balance of muscle forces. This balance of muscle forces will determine the proper growth and development of the jaws as well as the alignment of teeth. So here we are applying the concept of function determines form. The function of the soft tissues will determine the form of the hard tissues. I will repeat this once again so that it is very clear, because this part is very important. The muscles of the orofacial region have a dynamic relationship with each other, and all of these muscles in the orofacial region, they function in a harmonious manner such that they create a balance of muscle forces. This balance of muscle forces will determine the proper growth and development of the maxilla, the mandible, and the alignment of teeth. I hope it is clear till now. Now, just imagine in this whole harmonious relationship between the muscles that is going on, if one particular muscle starts to dysfunction or starts to function in an abnormal manner, what happens is the entire balance is disrupted. And the disruption of the balance of the muscle forces will create alterations, and these alterations will ultimately lead to alteration in the growth pattern of the jaws and also may result in the malalignment of teeth. So this is what it is, to put it in short. Abnormal muscle activity will lead to the creation of unbalanced muscle forces in the orofacial region, and this will further lead to the change in the growth pattern of the jaws and malalignment of teeth. Therefore, whenever we see malaligned teeth or crooked tooth or any kind of malocclusion, or whenever we see restricted growth of the jaws, like a retruded maxilla or a retruded mandible, we understand that the reason behind the malocclusion or the underdeveloped jaws could be the unbalanced muscle forces, and the unbalanced muscle forces are being created by some kind of abnormal muscle activity in the orofacial region. And this abnormal muscle activity is called the orofacial myofunctional disorder. So as we saw in the very first slide, what is OMD? What is Orofacial myofunctional disorder, it is any abnormality in the functioning of the muscles of the orofacial region. So in other words, we can also say that the etiology of malocclusion could be orofacial myofunctional disorder. Now, this is the entire concept behind orofacial myology. And if we can understand this, then we have already understood about 50% of the subject. Now, all we have to do is take this concept and apply it to our clinical practice. I will tell you how to do that. So once again, what is this abnormal muscle activity called? It is called orofacial myofunctional disorder. And what is the treatment for orofacial myofunctional disorder? It is orofacial myofunctional therapy, OMT. So this is what myotherapy does. OMT aims at correcting the abnormal muscle activity such that it restores the balance of the muscle forces and thereby helps in the proper growth and development of the jaws as well as the alignment of the teeth. And this is the very basic concept behind the use of myotherapy in the field of dentistry. Now let us see how to evaluate patients and how to come to the diagnosis of orofacial myofunctional disorder. Okay, so patient evaluation in this subject is very critical because we have to know the signs and symptoms that the patient is displaying, and then we have to come to the diagnosis. However, the diagnosis, as I said, is orofacial myofunctional disorder. But we need to understand what kind of orofacial myofunctional disorder is the patient suffering from. What are the muscles which are not functioning in the proper manner? And if at all they are not functioning in the proper manner, then what is the reason behind their dysfunction? Is there any anatomical or obstructive reason because of which or that is not allowing the muscles to function in the proper manner? Or is it just a habit and a pattern? And depending upon the reason behind the abnormal muscle activity, our treatment plan varies. Patient evaluation is also very critical in myotherapy because the signs and symptoms that the patients display will vary from patient to patient, even though they might be suffering from exactly the same kind of orofacial myofunctional disorder. How do we understand this? Let us understand it with the help of an example. Suppose there are 10 people competing in a 100-meter race. So they have to run through a distance of 100 meters. All of them are going to start running on the blow of the whistle from the start point and then finally reach the destination endpoint at different time periods. Now, let's say for the second round of the race, what I do is I take 10 identical pebbles, exactly similar in shape, size, texture, density, weight, and I put one pebble each into the left shoe of every participant. Now, with that pebble inside their shoe, I ask them to run from the start line to the finish line. Will they be able to do that? Yes, of course, they will be able to run. Maybe with some little difficulty, a little discomfort because of the pebble in their shoe, but they will all eventually be able to reach the finish line of the race. But in the second round of the race, what is going to change is the way that they run. Their steps are going to change because of the pebble in the shoe. Is the change going to be the same for all of them? No. The way that they will run will be different from each other. Maybe someone is going to limp a little. Some might drag one foot a little more than the other. Some might skid, or some might even trip and fall in between. However, eventually, each one of them are going to complete the race. The way that they will run will be different from each other, even though the problem that they are facing is exactly the same. That is a small pebble in their left shoe. But as individuals, their adaptation to the pebble is going to be different. Similarly, in orofacial myofunctional disorder, even if we have patients who are suffering from exactly the same kind of disorder, the signs and symptoms that they present is going to be very different and varied. For example, if we have two patients who have the habit of mouth breathing, the signs and symptoms that we see in them can be very different from each other. So we have to know all the combinations of the signs and symptoms that the patient might display while suffering from a particular kind of orofacial myofunctional disorder, so that we can ultimately narrow it down to a correct, proper diagnosis. Once we have arrived at the correct diagnosis, it then becomes very easy for us to devise a proper treatment plan. The treatment plan has to be customized for each and every individual, and that is why patient evaluation is so critical and important in myotherapy. The adaptation of a patient to a particular muscle dysfunction can be very different and varied. So the treatment plan will also vary from patient to patient. This customization will happen on the basis of the diagnosis that we have arrived at. So if we have the correct diagnosis, it is very easy to come to an appropriate treatment plan for that particular patient. Again, this subject of patient evaluation and diagnosis is a huge topic of discussion. But for today, what I want all of you to know is that we do the patient evaluation and diagnosis in two steps. The first is muscle activity evaluation, and the second is the soft tissue dysfunction analysis. In the muscle activity evaluation, in short, we try to figure out which all muscles in the orofacial region are not functioning in the proper manner and needs to be corrected. And in soft tissue dysfunction analysis, we check for all the soft tissues that are surrounding these muscles and try to figure out if there are any anatomical reason or obstructive reason that is not allowing these muscles to function in the proper manner. Once we have done a thorough evaluation, then we come to the diagnosis and accordingly we customize the treatment plan. Usually, after the patient evaluation and diagnosis, the next step is treatment planning. However, in myofunctional therapy, there is a crucial step before we start to do the treatment planning, and that is setting our treatment goals. Now, I will explain why setting of the treatment goals are so essential in myofunctional therapy. Let us understand this with another example. Let's say we are all planning to go on a journey from a particular place. The next step is to decide where we want to go, or rather, what our destination would be. Only when we know our destination, we have a direction towards which we need to move. Now, let's say there are 4 different routes to reach our destination. Each one of us might take a different route depending on our individual situations, but at the end of the day, we all will reach the same destination. Similarly, when we know our diagnosis, we know our start point of the journey. The second step is to decide our destination. That is where we have to finally reach, and that is to set our treatment goal. And then, depending on which route we take to reach the treatment goal, that is our customization of the treatment plan. Like how treatment plan has to be customized for every patient, treatment goals will also have to be customized according to the
Hello, ma'am.
patient's treatment
Excuse me, ma'am. Sorry to disturb
needs
you. You are not audible,
that are
ma'am.
common to every patient. Yes.
Ma'am, can you please?
Okay, wait, just a
You are
minute.
not audible. Yeah.
Yeah. Am I audible now?
Yes, yes, ma'am.
Okay, so from where should I start? Did I?
Ma'am, just one sentence, the last sentence.
Okay, all right.
Yeah.
So, yeah. So after, like how treatment plan has to be customized for every individual, the treatment goals will also have to be customized depending upon the diagnosis of the patient. However, there are certain treatment goals that are common to every patient who is suffering from orofacial myofunctional disorder. So I will discuss those common treatment goals one by one, and I will also explain why it is important for us to achieve those treatment goals for patients who are suffering from orofacial myofunctional disorder. There are 4 main treatment goals of myofunctional therapy. The first one is to establish good nasal breathing during the day and all along the night. The second goal is to establish proper tongue posture. The third is to establish a good lip seal. And the fourth is to establish a correct swallow pattern. Now, what does all of this mean and why is it important? Well, the theory behind myofunctional therapy or myotherapy is that in order to optimize the growth and development of the orofacial region, everyone should breathe through their nose instead of their mouth, and everyone should have a proper tongue posture. That is, with the tongue resting up against the roof of the mouth with light suction. Lip seal means the lips coming together, and correct swallowing pattern. Swallowing with the tongue present up against the roof of the mouth instead of sideways or forwards can be established only once nasal breathing and proper tongue posture have been achieved. So the first 2 goals have to be met first before the last 2 goals of myofunctional therapy can be met. So let's talk about the first goal in detail, that is establishing nasal breathing and why is it so important? Nasal breathing, as opposed to mouth breathing, is much better because our noses have a system that first filters, humidifies, and either cools or warms the air depending upon the outside temperature, and then lets the air enter our lungs. Once this filtered, humidified, and temperature regulated air enters our lungs, the oxygen that it provides is then optimally sent throughout the body through the bloodstream. Essentially, it has been seen that there is way more oxygen uptake in case of nasal breathing as compared to mouth breathing. With mouth breathing, the nasal filtration, humidification, and temperature regulation systems are all bypassed. This means that there are more foreign particles entering our body with mouth breathing as opposed to nasal breathing. So there is an immune component to nasal breathing that works in our favor as well. Mouth breathing leads to less oxygen uptake in the lungs, and therefore less oxygen is distributed throughout our body. Studies have shown that chronic mouth breathing can decrease lung function and can also worsen symptoms in people who have asthma. Now, let's move on to the second goal of myofunctional therapy, that is to establish a proper tongue posture and why it is important. Proper tongue posture is with the tongue resting up against the roof of the mouth with light suction. Why is it important? Having the tongue rest up against the roof of the mouth with light suction from infancy onwards. Yes, from infancy onwards is important because that suction exerts pressure onto the roof of the mouth, and that pressure allows the bones of the roof of the mouth to grow wide and flat to their full genetic potential. This wide and flat roof of the mouth or the palate can then accommodate all of the teeth, the primary dentition as well as the permanent dentition, without any crowding. And this is so very important. So many of us have crowded teeth, malaligned teeth. So many of us had to have teeth pulled out to make all the rest of the teeth to fit together in the mouth. If we can establish a proper tongue posture from a young age, all of that can be avoided. Another thing that has to be kept in mind is that the roof of the mouth is also the floor of the nose. So if the palate grows wide and flat up to its full genetic potential, that gives us a wide and flat floor of the nose as well, which helps to increase the oxygen intake and helps us to breathe through our nose better. So if we have the tongue which is not resting at the roof of the mouth, that means it is lying on the floor of the mouth at the bottom. In that case, it is not exerting pressure onto the palate. So instead of becoming wide and flat, the palate or the roof of the mouth now becomes narrow and arched. And this narrow arched palate cannot accommodate all of the teeth in proper alignment and leads to malalignment of teeth or various kinds of malocclusions. Not only that, The vaulted arch or palate, which is also the floor of the nose, now exerts pressure onto the nasal septum, causing it to deviate. And that deviated nasal septum makes it more difficult for us to breathe through our nose. This can also make mouth breathing a necessity for the patient. And for mouth breathing, as we all know, the tongue has to be on the floor of the mouth. So then it becomes a vicious cycle. That brings us to the third goal of myofunctional therapy, that is to establish a proper lip seal. If you start observing people around you, you will notice that some people walk around with their mouths hanging open. Now, this is because they are trying to breathe through their mouth instead of their nose. So, if a good lip seal can be established after the first two goals of myotherapy have been achieved, then that will not only help in restoring the balance of the muscle forces, but also help in preventing the mouth from drying and might also prevent in cavity prevention. And last but not the least, the fourth goal of myotherapy is to establish correct swallow pattern. When we swallow, our tongue should press against the roof of the mouth with slight suction instead of sideways or forwards. If it moves forwards while swallowing, then it is called a tongue thrust. The swallowing action is done approximately 1,000 times a day. So if it is done properly with the tongue up against the roof of the mouth, it exerts pressure onto the palate. This pressure allows the palate to grow wide and flat up to its full genetic potential. So now you see that myofunctional therapy is extremely beneficial to help in the proper growth and development of the face as well as the jaws, that is the maxilla and the mandible. And if there is good development of the jaws, it will further help in the proper alignment of the teeth, avoiding malocclusion. Now, the next question that arises in our minds is that why is it important for us as general dentists or general practitioners to know regarding orofacial myofunctional disorder? It is because orofacial myofunctional disorder has far-reaching effects, not just causing malocclusions or causing underdeveloped jaws. It has a variety of adverse consequences. Just to name a few, the first one, TMJ disorders. Temporomandibular joint disorders do not start overnight. There are oftentimes a long history of dysfunction, muscle disorder, incorrect tongue posture, or incorrect swallow pattern leading up to all of the symptoms. Now, people who are having incorrect habits since childhood, their orofacial development gets affected in such a way that negatively impacts their nasopharyngeal airway. Just for example, imagine a person who has a retruded maxilla and a retruded mandible. So what lies behind the maxilla and the mandible? It is our airway. So if the maxilla and the mandible are retruded, the dimension of the pharyngeal airway is compromised and it becomes narrow. So less amount of air is going into our body because of the narrow airway. In that case, the muscles of the head, neck, jaw, and the tongue, in turn, and all the soft tissues surrounding it, they compensate heavily so as to maintain the proper functioning of our body. However, after a very, very long time, some of these compensating muscles may give in, and that's when the symptoms start. Many of the patients may have a tongue tie, causing a lower tongue posture. So that also needs to be evaluated. Again, if poor orofacial development has negatively impacted the airway, it can lead to problems like sleep apnea or upper airway resistance syndrome. Poor oxygen intake by the body due to mouth breathing and compromised airway may lead to a variety of symptoms like headaches, fatigue, lethargy, and can also predispose the human body to a number of ailments. So now you see there are a lot of repercussions of orofacial myofunctional disorder, and it is so essential for us to diagnose orofacial myofunctional disorder as early as possible and treat it at the earliest. Once a patient with orofacial myofunctional disorder comes to us, we need to first rule out any anatomical obstructions that might be causing the dysfunction. An ENT consult may be required to check if the nasal airway passage is clear for the patient to be able to breathe through the nose. We also check for the frenal attachments if there is a tongue tie which might be present, restricting the tongue to rest up against the roof of the mouth, or any other underlying cause that might be present, not allowing the muscles to function properly. Once these possibilities are ruled out or corrected if present, then we have to move on to the use of myofunctional exercises. Myofunctional exercises help to retrain the orofacial musculature to function in the proper manner. Or in other words, to restore the normal functioning of the muscles of the orofacial region. But sometimes only myofunctional exercises is not enough. So we might have to take the help of certain myofunctional appliances or trainer appliances. Apart from this, another important aspect that we have to always keep in mind is the use of or giving the patient proper diet and nutrition, because without proper diet and nutrition, we cannot expect proper growth and development to take place. So with this, I have almost come to the end of my presentation. In short, to conclude, what does myotherapy do? Myotherapy restores the normal functioning of the muscles of the orofacial region in order to restore the balance of the muscle forces and thereby help in the growth pattern of the jaws, in the proper growth of the maxilla, the mandible, as well as the proper alignment of the teeth. So this brings me to the end of my presentation, Introduction to Orofacial Myofunctional Therapy. I know that after this lecture, you will have a lot of doubts and questions in your mind regarding this subject, which is very good because all the information that I have shared with you all today is just the tip of the iceberg. So here are my contact details on the screen. You can contact me whenever you feel that you want to learn more about myofunctional therapy. And with that, I would like to thank you all for taking time out to come here and listen to my presentation and for being such a lovely audience. Thank you so much.
Thank you so much, ma'am, for such an insightful session. I know the participants have loved it. For all the participants, if you have any doubts, you can also type your doubts in the chat box so that ma'am can answer it right away. So if anyone has any doubts, you can type it in the chat box. And for the participants who are asking for the certificate, I am sharing the certificate link, and it is mandatory to fill in the form to receive the certificate. Okay, ma'am, I think we'll wait for a few minutes that if anyone has any doubt, they will just type it in the chat box, or else I think we will be done with the lecture.
Sure. Okay.